Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Yeah.
Good morning.
Good morning, Anita.
The wonderful world of wellness.
We beat the sunrise.
We did. There's no sun. It's It's clouds. Or is it because it's a change
it's
of
still
time?
early. Let's see, probably in another 15 minutes we get sunrise.
Okay, well, it's happy anyway. I wanted to ask you about
Well,
this.
first I want to say good morning.
Good morning.
And I want to say thank you. Happy Thanksgiving to Mary that is listening to Marie that is listening to us from Germany. And to Renata also listening from Germany. So I want to say
that's right. Now
happy
that
Thanksgiving.
the technology is so great that anyone can listen anywhere.
Through the internet,
right?
everybody.
And if you've gone to the YouTube and you go to Boomer Times Presents, there are so many Andy Mencias down there. I mean, so many shows are all there. People can listen over and over. So maybe this show we should really talk about something that I know I've been wondering about, and I'd like to ask you about. You have now, of course, you have two wonderful nutritionists and dietitians, and they help people. But let's say people do lose weight, and now they're stuck with this kind of fatty stuff, and they'd like to suck it out. Now, there is liposuction.
There is liposuction.
But that's surgery.
That is surgery, right?
What else is there?
Well, there's a laser that Courtney had been doing very successful. And, anything that I do in the center, one of our center, I look for efficacious, how effective is whatever we are doing, and how honest, how true it is. Because we don't want to mislead the patient. The patient become your client and your customer and your friends.
And they're your friends. With you, they're friends, I know.
And so, the feedback that we get from patients is they love it. They see that result is on them, and they keep coming back, which means that they do like what they see, and they do like the results. So they keep coming back for more and more treatment.
Well, wait, put on your scientific hat. Now, you're very scientific. When you're not laughing and having fun. That's what I like about you. You turn on this thing so fast. What is it, though? What is it about lasers now? Lasers have really come into their own. Why? What does it do with your fat, and what happens?
We know so little about laser. There's so much still to be learned. But what we know about fat cells is that fat is like when you have water that can be solid, and you have the same particle of water, it can be vapor. And then you can have in between solid and vapor. So fat is one of those in-between cells. It's not like a muscle cell that is very rigid, and it's not like the blood or the liquid that come out of your nose, or when you urinate, it's not liquid like that. So it's in between, and it's easy to break apart. So, for example, when we do mesotherapy, what we do with that, which I do at the office also, is a detergent that we use. And we take this detergent and we inject it where the fat is that you want to get rid of. So let's say a person with a double chin or with a love handle that they want to drop on the love handle, or after the woman has baby, right underneath the belly button, they have this fat that won't go away. And we inject it with mesotherapy, and you see that the fat start dissolving. And how that works scientifically is the same way soap works on your hand. So let's say you are working with butter or any kind of fat in your hand. And if you try to wipe it off, it's really hard to come off. It just stick to you. But when you put soap, what soap does, it goes between cells, and it breaks cells apart. So they lose the adhesiveness they have. and then they sort of fall off.
That makes sense.
So mesotherapy in the injection, it goes into the area, let's say double chin or love handle, and we inject it, and it takes cells and it push them apart from each other. They lose the adhesion to each other, and then the body can now take it through the lymphatic system and through your guts, and you throw it into the toilet bowl when you go to have your bowel movement.
Huh.
So it's very interesting how fat can move, and we can get rid of fat. Laser will do the same thing without having to have the needle injected on you.
That
And it's
sounds-
much more
yeah.
accurate, because when you put the needle, then it becomes technician dependent. If I put too much, I can create then a big empty spot in there. And if I put too little and too far apart from each other, the patient won't see the effect. So with laser, you are accomplishing the same thing, but you have much better control of the area that you're working on.
Wow, I see. So, so it's doing that, and the lasers are it's cold, so it doesn't feel hot. Or
It doesn't
anything.
feel
It's
hot
a
or
cold
anything. It's a
laser.
cold laser. So a lot of people sort of come in skeptical because it's cold. I don't, you expect like hit me with something hard and
Right.
produce pain. It doesn't do that. So, but people sit there and then they get up and they exercise a little bit because we need to wake up the lymphatic system right afterward. We need the lymphatic system to start draining the whatever we have disintegrate. And
I would think this would be a healthy thing to do, isn't
it
it?
is healthy,
to
of
get rid
course,
of it?
because we want to get rid of fat. Anybody that is in excellent shape, they have very little amount of fat composition in their body, and they have more muscle. Now, this is so important for us, the boomers, because as we age, once we go past the age of 40, we start losing muscle mass. So 40, 50, 60, 70, 80. As we start aging and we get closer to 100, we're losing muscle mass day by day by day by day. So you just keep losing muscle mass slowly, very slowly. You don't even feel it, except if you acquire one of those devastating diseases that really speed up the natural process. Because when you develop a cancer, all the cancer is doing just speeding up what naturally happened on you. A cancer is nothing but cells that decided to multiply at a much faster speed than they normally do. And that's what a tumor or a cancer is. So either you develop a cancer, then you start losing a lot of muscle mass much faster, or if, let's say, a person develop HIV and they start then losing muscle mass fast. And the HIV patient is different because they lose fat too. That's why they become so emaciated and cachectic, because they lose the fat and the muscle mass. Now, when we lose the muscle mass, we become weaker than what we were, let's say, 10 years back. So we need to exercise, keep up some form of exercise, go walking, bicycle riding, treadmill, elliptical, stair climbing, whatever you like. I love walking. I grab my dog and just go for a walk. I love
And you
that.
think the walking is enough for your muscles? Don't you need things for your...
There is something. Well, depend how you walk. Some people, they walk with it and put their hand down. Other people, when you walk, you take you make two fists and you throw the fist above the shoulder to the opposite shoulder. So when you are walking, you are exercising your upper and your lower extremity.
Okay,
And,
I'm going to stop walking. What am I going to do with Snowy with the leash?
there you go.
I'm going to drive her crazy.
Exactly.
But that's what, I can feel it already.
Yeah.
Right.
And so when it gives you a lot of coordination. When you walk, when you're doing this, you sort of give you coordination. And then when you exercise, when you walk, you have to remember that you want to keep your exercise to be aerobic. Aerobic means that you want oxygen to be coming in. So when I'm teaching a class of exercise, I usually tell my students every 3 steps, you have to create a pattern. So let's say we are jogging or walking. Every 3 steps, take a deep breath
Really?
and exhale on the next 3 steps.
Huh,
So you
okay.
are walking, you go 1, 2, 3, 1, 2, 3.
Okay, I can do that.
So as you are walking now, you are exchanging air. Now, a deep breath, what you're doing is you're trying to get to the bottom of the lung. And when you exhale, you're trying to get rid of all the carbon dioxide, the CO2, right? So you are breathing now. Why is that important? Because when you exercise, the muscle aches and pain that we get is from lack of oxygen. So when you exercise and you breathe properly, you have enough oxygen, then your muscle will produce more, and then your muscle will be much more active. And if you notice, a lot of the athletes, when they put them on a intense training, they put an oxygen mask on their face.
Oh, I didn't know that. They did?
If you notice, when they put them on a bicycle and they have to go beyond normal performance, beyond normal human performance, they put an oxygen mask on their face so that the body can continue to go. Otherwise, they will be in so much pain because what happens when you exercise and you don't produce oxygen, you build lactic acid at the muscle level. And the acidity is what produces the pain, the muscle ache that you feel when you do too much. Let's say some people go and clean the garage and they don't stop and they just keep going, or cleaning the house and go up and down steps and they go, oh my God, my legs are killing me, my back is killing me, my arms. What happened? You have built lactic acid, and the lactic acid is what produces the pain. And the way you prevent the buildup of lactic acidosis or build lactic acid in your muscle is by breathing, by oxygen exchange. So you are getting rid of the CO2 and bringing O2, which is the oxygen. And that usually helps a lot, help the individual. And then by doing those any exercise, swimming, walking in the pool, and breathing properly, then you will assure to maintain the muscle depending on the level of activity. That was your question. So depending on the level of activity, you at least maintain your muscle mass or you build up on it. But you won't deteriorate.
Well, one thing that you're making me maybe go ahead and do, I've been really looking into Pilates. Mm-hmm. And I went to a studio to see what they do, and I think that really is good for your muscles. I may just start doing that. Are you very familiar with Pilates?
Yes, Pilates, very good.
Do you think I should do that?
It's like I do taekwondo, but I don't like to push for one type of exercise or another. It's up to you. It is what motivates you to get up in the morning and do it, or make sure that you do it, at least 3 times a week. It's what motivates you.
Oh, you're saying that if I start, I have to do 3 times a week? I was going to do once a week. That wouldn't be enough?
No, you want to do more than once a week. Once a week is a good maintenance, but
to build my muscles, I should do 3 times a week.
You have to get your body in shape so that 10 years from now you say, wow, I feel good still doing this. And, there are different modalities that come out. Yoga was once, in place and everybody wanted to do that. And then Tai Chi and then Pilates came along. So the modality will change with time. So it's like, which shirt do you want to wear today? Can I tell you what shirt to put on? No. You have to look at your closet and say, which one do I feel great putting on? So the exercise, you have to ask yourself, your personality, where you live. You might live in an area that is not safe. So going for a jog or going walking is not the best exercise. You might want to have a treadmill at home and do it at home. So all of that you have to take in consideration, but do something. Do some sort of exercise that will keep you active and keep you burning and building up muscle.
Well, I live on the 7th floor of a condominium, and they do have lighted steps going up and down. I always take the elevator. And maybe I really should start taking the steps. Maybe I can't do it all at one time. I mean, I'm pretty strong and all, but maybe I should try to do I should try to do that. One thing I think everyone should know, though, is...
And I do that when people come to the office. A lot of people, when they come, usually a guest, you want to take them through the elevator. And I ask them, I say, unless I see the person is handicapped or something, do you mind if we take the steps? Because I don't like the elevator. I like to take. And they say, okay, doctor.
You're right. But if they haven't taken the steps for a while, you're right? Okay, let's give phone numbers. Now, I have to just say that even if you already have a physician, and I really tell you right now that Dr. Mencia is a wonderful diagnostic physician, and if you're looking for a second opinion on something, and it's a good thing to do that. Don't go and have anything major done without a second opinion. And you know from the radio shows how much information Dr. Mencia knows. There's nothing I could ask him that he doesn't know. I mean, he is an amazing gentleman. So the AGI Medical and Dental Centers, one in Boynton Beach and one in Fort Lauderdale. The Fort Lauderdale is open on Saturday, and maybe the Boynton Beach is, I don't know. Sometimes they are and sometimes they're not. But let me give you a number for Fort Lauderdale. I know that they are open because Dr. Mencia runs out of here at 7:30
We
to
were
go.
open yesterday. Most offices were closed yesterday, Friday, the day after Thanksgiving.
Oh, were they? But you were open.
Yeah,
of course.
we were Black Friday, Black Friday medical dental.
Yeah, right. The reason is because your body doesn't know that it's a holiday.
No, exactly.
No. Okay, so the phone number, 954-489-1345. That's 954-489-1345 for the Fort Lauderdale office. And if you are, remember it's Pencil Talk Radio, get your pencils out. You should have had your pencils out to take notes as we were talking anyway. Boynton Beach is 561-270-6494. Home visit services are available for homebound patients, and it is very important that you know that. Please don't sit there at home, feel bad, and no one's going to come help you unless you call the AGI Medical and Dental Centers. And also, go on their website. It's agifl.com, agifl.com. It's really so, and remember, Dr. Mencia is a geriatric physician. There are not many of them, not truly geriatric physicians. And so what does that do for him? Well, that makes him understand a lot of things as one is aging, just like he talked about now with your muscles. And first thing he's going to do, of course, is get you out of bed when he comes to visit you. Get up and get going.
Get up and on your feet.
But see, older people are walking. I see there's a church at the end of we live now where there's a little park, and you see these groups of people, 6 and 7, and they're walking from church, and then they walk to church, and it's quite nice because it's a social thing when you walk, too.
It is, and, you get a lot of people that come into, I had a patient that came in, and she had concern about the memory. We were talking, and she was listening, and said, I listen to you on the radio, you and Anita. But I do have my doctor, and you guys keep saying, even if you have your doctor, come in. So I want to come in, and I'm willing to pay you privately so you can see me, since I still have my doctor, and I just want to sort of interview you to see if I like you or not.
Oh, that's a good one, interview you.
I say, well,
okay.
That's fine. And I told her, but you don't have to pay. And she said, no, but I want to keep my doctor until I finish my interview. I said, no, honey. I'm a geriatrician. I have a specialty. So your doctor is a family practitioner. That's your family doctor. So today visit, because you say you have a memory issue, you're going to see me, and we're going to do a geriatric assessment. And we're going to look not only at your memory, we're going to look at your bone structure, your muscle structure, your diet. We're going to look at your vitamins level. We're going to look at all those things. And then you can go back to your doctor with all this information and tell your doctor, this is what my geriatrician recommended for me to do.
Excellent.
So she came in, and we sat down, and we drew the blood, and said, you don't have to pay. Your insurance will cover. And if there is a problem, then come back and pay. But let the insurance pay for, you already, that lady is 80, 84 years
Oh, of
old.
course.
And I say, you already earned this thing. This is not a freebie for you. They are not giving you Medicare because they're having pity on you. We pay through taxes and all of that. That's how you get your Medicare and your insurance coverage. And she said, okay, so we did the blood test. Her B12 was one of the lowest we have seen.
Really?
Her vitamin D was extremely low. And simple thing that the family physician should have been attending to. And we told her, I said, first, we have to adjust your thyroid medication. You have to start taking vitamin D. No, but I'm taking vitamin D. And my doctor told me it was okay. I said, no, it's not okay. But doctor, how can you contradict? You just say I need vitamin D. I am taking vitamin D. I said, which one you take? So she take Caltrate or one of those. I say that one has 600 milligram of calcium and only 400 international unit of vitamin D. The one that I'm recommending is 5,000 units.
That's what I take.
So
yeah.
400 unit, 5,000 unit.
Yeah.
Do you see the difference? She goes,
yeah.
Yes, I see that. I say, well, the 5,000 unit is going to fill up the tank. Then you can go back to your maintenance dose of 400 international unit.
Oh, wait a minute. I keep taking my 5,000. Am I in trouble?
No, you're fine. You're fine because what that will do, the next time we check your vitamin D level, we look at the level. If the level is still, let's say, half of where we want to be, let's say you are 40, 45, we keep taking it. Once we are above 60, then we can go ahead and switch.
But I swing from trees.
There you
so
go.
I want to keep taking my
keep
vitamin
taking it.
D.
No, absolutely. I keep taking mine too. So, I mean, it's the strong dose is important. And the other thing I tell my patient, if the level goes too high and you are concerned, take it every other day. But at
How
least
would you be concerned? Why would I even be
some
concerned?
people, they think, oh, it's too much. I don't want to take it. And
don't
I
you
tell
just
them,
pee out?
it's like,
Don't you just urinate?
Exactly. And it's not like vitamin A. Vitamin A, you can get toxic with vitamin A, and it produces night blindness. But vitamin D, no. Vitamin E, no. As a matter of fact, some of them are good blood thinners to prevent strokes. That's why people recommend vitamin E and vitamin C to patients because, it's especially vitamin E is a good blood thinner,
And I've been taking magnesium. I don't want to get off the subject because I know I want you to continue with what you've done with her. But I have been taking magnesium, and it's really helped my blood pressure and everything. It's really a wonderful thing to take.
Magnesium, yes. Especially if you take calcium. You have to take calcium with the magnesium.
Oh, I am not doing
and
that.
the vitamin D because, you're taking magnesium.
Yeah,
so
taking
if you
the D.
If in your diet you're taking calcium someplace, it will help your bone structure.
Okay. But let's go back to this woman.
Lady,
I like what you're saying.
So, she did the test and everything, and we showed her how low her vitamin level were. And we sent it to an independent lab and our lab, and it proved that, she's extremely low. So she asked me, what medication do I need to take for my memory? I say, nothing. You need to start getting vitamin B12 shots, and we're going to start that today. Now, if you want to go back to your family doctor, what I'm going to do, I can send a nurse to come to the house. So we can do the B12 shot weekly. You need to do it. You are very low. So you need to do it weekly for about 4 to 8 weeks, and then just have her come in monthly and give you the shot at home.
That is a wonderful thing to hear, and that will help her
she
memory.
Say, is that what you do for your patient? I say, no, they have the choice of coming to the center and getting the shot or the nurse going there, whatever they want. I say, I decided I'm going to change doctor. So you're going to be my primary. I guess at 82, I deserve it.
Well, see, that's why you go for a second opinion. And I'd like to, in our next show, I'd like to go into more about the memory and what you're doing for people with memory problems, because I think if someone could come to you and they could have those kinds of tests and it will help their memory, that's really amazing.
And we get the
and
result within 24 hours. The results are right there. Sometimes I can get the result on the same day. my lab technician, Shirley, she comes in and she run the test. Oh, by the way, she love when you guys run this show because she's Jewish. She don't listen to the radio on Saturday. So she
So
said,
she can hear- yeah,
when
we
you
put it-
run it on Sunday, I love
We
it
do.
because that's why she always tell me, tell Anita that when she run it on Sunday, I love it because I can listen to the show.
Right, yeah, right. Well, we can't do it every Sunday, but we do try to keep. But she can listen to just get
To
on
the-
to
yeah,
YouTube
that's what
and
she does, yeah.
she'll hear that. But I do want to on another show that we do. I want to talk a lot about what you've just decided with memory and how it's just people just shouldn't be say, well, I'm getting older and that's what's my problem, because it could be vitamins, it could be exercise, it could be a lot of things. So let's talk about that when we come back. So anyway, I want to just tell you, Dr. Mencia, that we really do appreciate all the information that you give people. I know people.
I love coming to the show.
Well,
I
people
love
really
coming.
appreciate that. There's no other place that they can hear it in such a relaxed way with so much laughter, and you
Yeah.
know, you
And that's
have a
what people like,
wonderful
people
way.
that give us feedback.
Yeah, well,
they
because
like that.
look, picture someone, it's a holiday, it's not a holiday. They're at home, they're alone. We're friends. That's
Right.
what's happening.
Exactly.
It's like
Exactly.
there are a lot of friends. Okay, so we have to go, and we'll be back.
We'll be back. Mary, don't go away. Stay tuned. We'll be back
Don't
after the
nobody
news.
go away. We'll be back.